started. I hope everybody, we had a couple of people walk in, so if you just want to silence your cell phones, turn off any alarms that you may have set. So, this is part 2 of my 3-part presentations. The first one was staying independent in your independent living apartment. So we talked about how to stay in your independent living apartment. This one, part 2, is going to be those what ifs. A lot of residents ask, what if I get sick? What if I stop driving? What if I want to get a dog? All those kind of questions. So I've kind of taken all those questions that I've gotten over the past couple of years and put it into a PowerPoint. So hopefully it answers most of your questions. At the very end, I will open it up for questions. So if you think of any other what if questions, just let me know. Sometimes those questions are very personal to the person asking them. So if you want to meet one-on-one, we can certainly set up a time to meet one-on-one if you don't feel comfortable asking it in front of a big group. So my name's Robin, recently changed to Gonzalez, not legally yet. So if you still call me Akins, that's fine. I will answer to just about anything. Some people call me Rachel. That's fine. We're going to answer to anything when we're answering your questions. So I am the Director of Resident Health Services. So I'm the nurse for independent living. I have an MSN, so a Master's of Science in Nursing from UT. I am a registered nurse, and CDP is a certified dementia practitioner. So I've done some extra classes on dementia. That's the way to get a hold of me. You can email me, you can call me, leave a message on my work phone. I will call you back as soon as I can, or stop by my office. So we're going to talk about what if. Information pertaining to independent living, so changes in your health, personal caregiving assistance, therapy, pets, emergencies, other random things, and then a little bit on higher levels of care. I'm not going to get much into that. My 3rd presentation in August, we're going to talk in depth about skilled nursing, rehab, and assisted living and memory support. So a lot of doctors are retiring, it seems like, in the past 6 months. Some doctors are aging and not wanting to provide services any longer. So I've had quite a few residents on the lookout for new physicians. So if you do change physicians and you're not using a Westminster physician, please let us know. We really want to know who your doctor is in case there's an emergency, in case there's an issue with your health. We like to update that on your paperwork, on your face sheet that's in your vial of life in your refrigerator. If there's an emergency in your apartment, we do notify your doctor just to let them know. So if you have a fall, or if you cut yourself, or we sent you out to the hospital for any reason, we do fill out an incident report and send that to your doctor. So it's good for us to know who your doctor is. Also, if we're requesting therapy orders and we need to get a hold of your doctor, if there's an issue with your medication or we're noticing some changes in your behavior and your health, we really need to know who that is. So if your doctor is retiring, or you want to change doctors because they're not responsive, or they're reducing their hours so much that you can't get in to see them, we can give recommendations on other groups or other physicians. We do have 2 doctors here that accept independent living residents, and so that's Dr. Michael Kroll. That's Kroll with 1 L. There is a Kenneth Kroll, who's outside of Westminster, and then Dr. Pellegrini. There is a little bit of a wait list. They accept people as people move on, then they take on new clients. So there is a little bit of a wait list for Dr. Pellegrini. So contact the clinic or me, we'll get you on that wait list, and then once Dr. Pellegrini or Michael Kroll accepts people, then we'll contact you. What if you are having an illness, if you're sick, if you have an injury? So you can always certainly go to the clinic. They're open Monday through Friday from 8:30 to 5. We do have some walk-in services, but it is really good to make an appointment because they do fill up really quickly, especially Mondays. because of everything that happened over the weekend, and Fridays because everybody wants to be seen before the weekend. If it's during Tuesday, Wednesday, or Thursday, then it's more likely to have an opening for a walk-in, so just give them a call. If you're having an emergency in your apartment, push your pendant or pull your pull cord. Can I see a raise of hands of who has on their pendant? More than last time? So I always advise residents to wear their pendant because you never know when an emergency is going to happen. If you're out in the courtyard and you trip over a rock, or they're mowing the grass and the wind blows you over. I don't know. There's always some kind of emergency, so we suggest that you wear your pendant just in case. A lot of residents don't wear it until after an emergency happens, but I have to educate you to wear it. So if you're needing a nurse, please push your pendant or pull your pull cord. Do we remember from the last presentation, if somebody else is having an emergency, do you push your own pendant? No, you push theirs, because we're going to be looking for them, not you. If EMS is needed, you can certainly call them on your own, but please still push your pendant or pull your pull cord, just so we can come and help you. We can do some things in the interim until EMS gets here. Where my office used to be overlooked where EMS would park, and so sometimes I would be sitting at my desk and see EMS pull up, and I would have no idea why they were here. So I'd run up with them, and it was a nosebleed or something like that that we could have handled really easily instead of calling 911. If you are sick, have an illness or injury, you can hire your own private duty. If you hire someone from an agency, they vet their employees, they will find coverage if someone's ill and can't come see you. If you hire off the street or a friend or family member, then there is paperwork that has to be done in my office. That's just, we want to know who's on our campus. We want to make it safe for you and the other residents also. We can also do home health, so if you have a new diagnosis or a change in your condition, we can get home health involved where a nurse comes to see you. And we also have wellness checks, so that's a program that we have here at Westminster that is complimentary, where we can see you up to 2 weeks, up to 3 times a day, up to 30 minutes each time. Everybody's situation is different, and so we can adjust that as necessary. If you have the flu, or you have COVID, or some type of contagious diagnosis, stay in your apartment. Don't spread it around Westminster. You can call me, call the clinic to report this, and we can come up to your apartment to see you. But if you do a home test in your apartment and it's COVID positive, and then you get on the elevator with other people, and then you walk through the bistro and you're coughing, you're gonna infect other people. We try to limit that as much as possible. So if you've got any of this, call us and we'll come see you. We can also do meal delivery and wellness checks. So during that time where you are ill or contagious, we can do free delivery for you. And just a reminder that the healthcare center is not a hospital. You have to qualify for admission. There are requirements because it is a licensed area. There are certain requirements that you do have to meet. You have to have doctor's orders, things like that. So if you're just not feeling well on a Tuesday, you can't walk over there and say, I'm checking in for the night, I don't feel good. There are things that we can do to keep you comfortable in your apartment. So if you have a planned surgery or procedure, I really like residents to let me know that this is going to be happening. So you can call me or email me to let me know the date of the surgery and or the procedure, the doctor that's going to be performing it, the hospital it's going to be at, the type of procedure, and the anticipated length of stay. Even if it's an outpatient procedure, so say you're having dental surgery and you're going to have 5 teeth extracted. Yes, it's not major, but that lets us know there's something going on with you. So if you come home that evening and you're a little doped up from the anesthesia, we know why. If your mouth starts bleeding, we know why. If we just go in blind, not knowing you had dental surgery, then, then we're calling 911 and trying to figure out what's going on with you. But if we know you had some type of procedure, we can proactively provide care for you. Sometimes, well, not sometimes, a few times I have had residents go in for a procedure, and then they're calling me on a Friday at 3 o'clock saying, I'm being discharged, what are you gonna do for me? And that's hard, setting up services late on a Friday. Can we do it? Yes, but having some advance notice is always good, because I put you on my radar. I keep a list of upcoming procedures, just so that I can call you before and after to make sure you're okay. If a stay is needed in the healthcare center, then I coordinate that with them, getting you a bed over there, making sure that transition goes smoothly. We can also reserve a spot on the wellness check schedule. So if you call me on Friday, you're being discharged from the doctors, and you're gonna be home at 4 o'clock, we may already have that 4 o'clock spot filled, but if we knew in advance, we could plug you into that schedule so that they can see you at certain times. So what if something happens outside of Westminster? Sometimes you go out with family. I've had it where a resident went to a restaurant and tripped over one of the parking cement thingies, whatever it is, and fall, and then the family had to take them to the hospital to get stitches or whatever it was. I like to know if you go to the hospital or if there's an issue outside of Westminster, just so I can follow up on your care. Some residents keep my business card just in case. We did have a resident a couple years ago who we advised not to travel, but he really wanted to go to New York, so I put my card in his wallet just in case anything happened while he was there. Their hospital, their EMS knew where his home was, and they had somebody to contact. So I brought some cards if y'all want to take some with you. You can have your spouse or family notify me as soon as they can if you have to go to the hospital or there's some other issue. But do remember, this is independent living. Some residents go to the hospital and they say that they live in assisted living, which there are different services. So when the hospital's trying to discharge you, their idea of what assisted living is way different than what independent living is. And so they're thinking assisted living, there's gonna be staff 24/7, you've got someone managing your medications, but we don't have that in independent living. So it's really good to know those differences if you do have to go to the hospital. And for your family too, because sometimes family will say, oh, they're in assisted living, but they're not. They live in independent living. So if you return from the hospital and you need assistance in your independent living apartment, evenings and weekends. So we do have the wellness checks. So you can either call my office or get with reception. They, either I can call a wellness aide or they can radio for a wellness aide. The schedules are set, so as people are ill or are coming back from the healthcare center, we plug them into this 24-hour schedule that we have. So they will respond when there's an open spot. So if you call at 3 o'clock and you're like, I just got back from the doctors, I got anesthesia, I need someone to come check on me, they may not come to you until they have a spot open in their schedule. So that's why it's really important to let me know if you've got a procedure coming up. You can hire your own caregiver, so through an agency or another private person. The resident or the family would have to call. I cannot call and set that up for you. Other residents should not be calling and setting that up for you. You know, they're gonna ask for a credit card, they're gonna ask for a schedule, they're gonna ask for your health history. It really should be the resident or family calling. If you're needing overnight care or extended care longer than what the wellness checks can provide, then you would need to go with an agency. And it may just be for a day or two until you're feeling better. So if you're needing the healthcare center after surgery for rehab and recovery, so say you're having a hip replacement or a knee replacement or some type of surgery that's a little bit more complicated than what we can accommodate in independent living, or you're sent out by EMS, I follow up with the case manager. I make sure to let them know this is independent living, everything that we provide. Sometimes the doctor in the hospital wants you to go to a skilled nursing facility, so then I coordinate with the healthcare center on a potential discharge date, and then healthcare coordinates transportation to them. Since you're an IL, independent living resident, we can move over a couple of things. We can't move your whole apartment, but we can move your clothing, TVs they have now in healthcare, We can move a recliner just to make it a little bit more home-like. I also get daily progress updates, so every day, Monday through Friday, we have a stand-up morning meeting. That's where I talk about people that may be on my radar, who are declining in health and may need the healthcare center soon. I talk about people that are having upcoming procedures or surgeries, just in case they may need healthcare. So we coordinate a lot during that meeting. Once a week, we also have a navigator meeting where we kind of talk about extended out timelines. So if someone's having surgery in 2 months or 3 months, we talk about what's coming up, who's admitting to the healthcare center, who's discharging back to independent living. So we really work together to maximize movement through the different levels of care. And then I help coordinate a return to independent living if you need assistance with that, or if you're going to stay permanently in the healthcare center, or if you're going to go from the healthcare center and move into assisted living or memory support. We talk about that and we coordinate that. So, say you're finding it more difficult being in your apartment and you're concerned about your safety. Maybe you're tripping more or you're having falls. We really want therapy to come in and do an evaluation. Maybe they help you take down your rugs so you don't trip over them. Or maybe they help you get rid of your rugs because they're unsafe. Or maybe you need an assist bar in your bathroom. We really do like to get therapy involved to help with those types of things. So they'll look for hazards, rugs, cords from lamps, phones, and TVs. You know, if you've got, I think we had an issue over here where we had a cord and a resident got a little bit tangled up in it. So they'll look at things like that, help you tape them down or find safer ways to do them. If you have light bulbs that are out, light is really important, especially when you have low vision. So if you have light bulbs that are out, let us know so we can help take care of that. If you like to keep everything and never throw anything away, maybe you have papers on the floor that are creating an unsafe condition where you might slide on them, or if you're furniture walking and you put your hand on it and the papers slide out. So they really look for hazards like that. Maintenance therapy and an organizer can also assist you. If you have any change in transfers, so transferring out of your recliner, off your couch, on and off your toilet, in and out of the shower, therapy can really work with you in coming up with creative solutions on how to safely assist you with that. If you're noticing it's harder to get to places in Westminster, so your endurance, your strength are lower, they can help with that. So what if I only need a little bit of assistance? If you only need a little bit of assistance for a little bit amount of time, then that's where the wellness checks come in. If you need just a little bit of assistance, but probably for the rest of your life in independent living, so this is where you would hire someone to come assist you. We do work with several agencies. They do have some of them have a bigger presence here at Westminster, so they can provide 15-minute visits up to 24/7 care. So these would be like med reminders, assistance with dressing and undressing in the morning and the evening, or standby assistance for showers. Sometimes the residents, as they start to decline in their health, become scared or nervous about taking a shower. That's a big fall risk. Floors slippery, you're trying to get dressed or undressed, it's just not a safe environment. So sometimes you need someone that's with you to help you stand by while you take a shower just to keep you safe. If you're needing longer time, so assistance getting to activities or around-the-clock care, if you have any questions about that, just come see me and I can give you some recommendations. Can everybody hear everything? Not everybody. So we have audiologists that come here. So they come twice a month. We have 2 mobile providers, so the first and third Wednesday of every month. If you want to set up an appointment, you would call them directly. The flyers for those providers go up about a week before they come, so you'll see them in the elevator, so you just call and set up your appointments. There are also telephones amplified, talking caller IDs, relay services, and then closed caption telephone services. So if you're experiencing hearing loss and you don't know what to do and it's harder to converse with people, come see me or the clinic and we can assist. Maybe it's just clearing out some earwax. Some people who have hearing aids build up more wax faster because it's a foreign object in your ear, and so it builds up more wax, so we can help you clean that out. Can everybody see everything? No, not everybody. So you can purchase a magnifier. Some residents have a big magnifier in their apartment. Brighter lights help, so if your apartment is kind of dark and comfortable for you, it may not be easy to read things. So you may need some brighter lights in your apartment. There's a video magnifier in the solarium. I think it's still there. I haven't heard that it was moved. There are larger print items and newsletters, so the weekly, the monthly, you can go to the portal and enlarge things, so we can assist you with getting anything that we have in a larger print. You can hire someone if you need help with paperwork or organizing in your apartment or medication management. Sometimes those pills are itty bitty, and when you're trying to get them out of your pill bottle, you may drop them, and then you're trying to find that on the floor or on a white carpet if it's a white pill and you can't, so sometimes you've got to get med management involved. There are medication dispensing machines that can help with that also. Occupational therapy can see you for an evaluation and recommendations for any apartment modification, so it could be brighter lamps, magnifier, things like that. There's also books on tape through the National Library Services, so there's an application with Rachel Gill. If you're having a physical decline, first we would want you to be checked out either by the clinic or your own doctor. So maybe there's something else going on. Maybe we do some lab work and we find out you have anemia and that's why you're weak. And if we can get you some iron, get you feeling better, then you get that strength back. So the clinic or your doctor can always do labs or an evaluation. We can do therapy orders. They can recommend adaptive equipment. If you can't get all your strength back, maybe a walker or a cane or a wheelchair or even a scooter might be in your future. And then again, apartment modifications, adaptive equipment, grab bars, removal of rugs. If you purchase a motorized scooter, we ask that you tell us beforehand. There are so many different types of scooters that therapy can work with you ahead of time to figure out what's the best one for you. If you go ahead and purchase one and have it delivered, we still like therapy to work with you because we don't want you to run over people or take corners too sharp or ram people in an elevator because you tried to go in. I've been run over by a few. And so we just like you to have some training of the best ways to get around Westminster, how to navigate the hallways, how to navigate the outside spaces. Sometimes when you're walking versus in a motorized scooter, things look a little different. You're moving at a different speed, and so they go over all that with you. There's also exercise classes here to help with any physical decline. We can have a conversation about possible assisted living or the healthcare center if we know that strength and conditioning is not going to come back. Then you can also privately pay for assistance in your apartment or a personal trainer or massage therapy. If you need some durable medical equipment, so say you need a 3-in-1 toilet chair, so that's that little chair that goes over your toilet that has arms that can help you get on and off the toilet. We can help you with that. If you need a shower chair, a wheelchair, a walker, a hospital bed, or oxygen, we can give you recommendations for that. We can also help purchase. If you're needing a shower chair, we can look on Amazon and I can purchase it and then we just add it to your bill. So just let me know if you're needing some type of device. So if therapy is needed, if you think about it and you really want therapy, you want to be proactive, you're noticing a decline, therapy is it's good. Try it. Maybe it'll help, maybe it won't, hopefully it will. So we can get orders from your doctor or from one of the clinic NPs, nurse practitioners. I can also request orders from your doctor if I have the right doctor. The verification of your insurance is done through my office, so my assistant does that, and then we send the orders to Select Rehab. Then Select Rehab will call you to set up that evaluation and treatment plan. Any orders that you get, If you go to a doctor's appointment and your doctor wants you to do physical therapy, please bring those orders to me or Diane. Diane's in the clinic. If you give it to rehab, sometimes there's a delay because then they have to give it to us. But if you bring it straight to me or Diane, then we can get that going really quickly. So they select rehab. Their office and treatment area is located in the Windsor on the first floor across from the clinic. They can also treat you in your apartment or the pool. They do physical, occupational, and speech. Physical, I think about the big muscles and the big movements, the walking, the strengthening, the endurance. Occupational is more of those smaller movements, so buttoning your shirts, hygiene in the bathroom, things like that. Speech, I think of from the neck up, so swallowing, cognition. They work with Halcyon Home Health. We can also do Part B services to your insurance. And then again, they can do therapy in your apartment, in the gym, in the rehab gym, or in the pool. What if I'm losing or gaining too much weight? Some residents move into Westminster and gain 15 pounds right away because we provide so much food. And sometimes we want the chili dog instead of the nice salad, or we want the big steak and the truffle mac and cheese instead of a healthy chicken sandwich. So some of it is our own choosing. Sometimes it's not. So if it is not, you can certainly come to the clinic or go see your doctor and do some labs and do an evaluation. Speech therapy, if you're losing weight because you're having pain, dental pain, speech therapy can work with you. You know, we can have you go see a dentist. If you're having swallowing issues, we can do an MBS, which is a modified barium swallow study, so they see how food goes down. If there's certain diets you shouldn't be eating, they can work with you on that. We also have a dietary consultation with a registered dietitian. She usually goes to the healthcare center. Since it's a licensed area, she has to review everybody's diet. But for independent living residents, Westminster does pay for the first hour if you want a consult. If you need her after that, then I think it's like $60 an hour. There are alternatives. So instead of choosing the bacon cheeseburger with fries for every meal, try some healthier options. We have different dining options and then meal delivery. If you're finding it hard to get to the dining options, then they can do delivery to your apartment. What if I'm noticing cognitive changes? So this is like memory. What if you're finding it harder to remember your friends' names, or remember how to get around Westminster, or remember where your apartment is? Again, the clinic or your doctor can see you and do labs. The first thing that we think about when someone's having some type of memory issue is a urinary tract infection. So a UTI in this population can cause memory issues. So that's kind of the first thing we look at, so we want to rule that out. So make an appointment with the clinic or your doctor. Sometimes your friends know before you do. Like you're really good at bridge, and then you show up one day and you like lose everything, then they will let me know like, hey, Miss Smith isn't doing so good at bridge, and so then we'll start the conversation and maybe get you in to see the clinic. So speech therapy does cognitive testing, can help with memory strategies. Maybe having a calendar is good for you. I know people live by their calendars. If it's not on my calendar, I will forget it. So that's just a memory strategy for residents, engagement and activities. We can also advise, if you're driving, that you do the driving course with St. David's. That's where an occupational therapist will evaluate you and your driving skills and let you know if you should continue driving or not. If you're forgetting to take your medication, we can talk about medication management. Rachel Gill also does some cognitive testing. She can discuss the results with you and kind of how to boost recall. We can do assessments for assisted living or an assessment and a move to memory support. But that's kind of a range of things. The first thing I'm not going to say is you need to move to memory support. We're going to rule out everything first. This is Rachel. I'm sure most of y'all have seen her around. So she's responsible for meeting resident social, mental health, and cognitive health needs. She has support groups, but also individualized meetings with residents. Various groups on topics that include brain, memory health, provides supportive counseling, connects people to outside programs and resources, and organizes charitable projects. She provides new resident orientation, and then when residents move out of independent living, she assists with that process also. So what if you're feeling lonely or unmotivated to join in? Sometimes that happens. You know, review the monthly, the weekly, and daily calendars. We have so many activities here at Westminster. If anybody ever tells me they're bored, we've got other issues, because there are so many different things happening at Westminster every single day that there's something that we can find that you can enjoy. If not, we'll try to create that. You can join a support group or a discussion group. Rachel Gill can meet with you to discuss activities, kind of go through the calendar with you, pick out things that may interest you, make suggestions. There's talk therapy. We can get an agency or a caregiver involved. Sometimes they're hired for companionship. So you may be feeling lonely and find it a struggle to get out of your apartment and get to activities. You can hire a companion that maybe can encourage you to go do those things. And talk with your friends, if you've got some. I hope you do. I think everybody's got friends. So what if, I think it's depression or anxiety. Again, we want the clinic or your doctor to see you. Maybe there's a lab that's out of whack that may be causing this. So they can evaluate you. Rachel can work with you. We do have a psychologist that comes here, Dr. White, so she can see you. We do also have connections with psychiatry services. Rachel has a grief and loss group. And then there's classes here at Westminster. Sometimes getting out of your apartment can help with that, going for a walk outside, doing yoga or aquatics. Aqua. What if you're experiencing grief or loss? So this could be loss of your independence. You know, if you go to a walker or a wheelchair, or you're finding it harder to get to the dining rooms to eat with your friends, or you've lost a pet, or you've lost a spouse, or another family member, son, daughter, any type of grief or loss. There is the group with Rachel. Please talk with residents. Please don't hold it inside. Please let us know if you're struggling with anything so we can help you. If you don't tell us, we don't know. We don't want you to struggle up here when there's things that we can do to help you. If you're having driving difficulties, so maybe you're giving up your car, which decreases your independence because you're used to going everywhere all on your own. There is the St. David's driving course where they can give recommendations if you should be driving or not. We do have the little store. We have Westminster presentations. There's Uber, Lyft, and a taxi. There's transportation through our Westminster drivers for doctor's appointments, banking, grocery shopping. We do have a Westminster driving and transportation guide, so if you'd like to have a copy of that, just let us know. There are delivery services, so things like your medications, your groceries, pet supplies, anything can be delivered. When COVID happened and HEB did their online delivery to your home, I started that and I have not stopped it. Because it's easy to sit in your chair and order everything and then it just shows up at your house. So anything you need, we can help you get it. If hospice is needed, so this could be for yourself, it could be for a spouse, it can be done in your independent living apartment. So your care is managed by a hospice nurse. Caregivers come to help bathe you, usually a couple times a week. They bring supplies, they manage your medications. They can get you a hospital bed, oxygen, bedside commode, a wheelchair, low air loss mattress. There's a lot of things that they can do for you, but they don't provide 24/7 care. So if you need someone to be with you 24/7, either you'd have to hire someone or we would have to talk about a move to healthcare. You can stay in your apartment unless it's unsafe for you to be there or your pain is not managed. So what if another resident needs assistance? And we talked talked about this in the first presentation and then a little bit at the beginning of this one. If another resident has fallen or needs assistance out of a chair, please do not help them up yourself. They could fall on you, they could injure you, and then I've got 2 injured people. Please push a pendant, pull cord so that security and nursing can come help. If a resident is asking you to set up services, so that say they come back from the hospital and they're like, Mary, I need someone to stay with me overnight. If you, out of the goodness of your heart, want to stay with them overnight, I cannot stop you. But then you become the caretaker. And I don't think a lot of people want to do that. So, I do have copies, I didn't bring it with me, but how to set up services, different agencies that we work with to make that a little bit easier. They can also get a copy of it at reception. So they or their family must set up that service. You can email or call me, and I can also help where needed. If it's Friday at 7 p.m., I may not check my email till the next day or Sunday, so there wouldn't be an immediate response there. You need a higher level of care. So we have that discussion one-on-one, well, with you or your power of attorney or your family member. We talk about what that looks like. I do have an interest list that of residents who have talked about assisted living or memory support or the healthcare center, so I keep that list. An assessment is completed, you do have to qualify, especially if it's spouses. If one of the spouses is appropriate, but the other one is highly independent, you wouldn't both qualify to go to assisted living. So we would have to talk about one going and one staying, both staying and independent living. So there's every scenario. So it is really good to talk one-on-one, talking through those types of logistics. And then we talk about a timeline of a move. If you pass the assisted living, memory support, or healthcare assessments, then you have a certain amount of time to move in, and then you have a certain amount of time to vacate your independent living apartment if you're completely moving out. If you think someone else needs a higher level of care, so like your friend, your neighbor down the hallway, please notify me or Rachel if you're noticing some changes in a resident. Many times we're already in the process, so it doesn't surprise me when someone says, oh, I'm sorry, I keep using Miss Smith. Miss Smith is declining, she needs help with this. Usually we're already somewhere in that process of getting care, trying to change caregivers, having meetings with the family, having meetings with that resident. But it's good that if other people are seeing it, that they let us know. It is a process. Sometimes it can take several weeks up to months. Please be respectful, be patient. One day it could be you, and you would want that same level of respect. So situations that are not compatible with staying in independent living, unless you have 24/7 care in place. Agitation, combativeness, aggression, delirium, psychosis, if you're a danger to yourself or other residents. If there's confusion where you're wandering outside the building, next week's gonna be in the hundreds. It is really unsafe for a confused resident to be outside for hours on hours with no water. Or when we had our freeze and it was 19 degrees, if we have a resident that's wandering outside, it really becomes a dangerous situation. Sometimes residents decide to walk down 45th Street. I mean, there are some unsafe situations and we've really got to figure out a plan to keep the residents safe. Incontinence that's not manageable independently. You can be incontinent, but you have to be able to manage that. So knowing when you're incontinent and being able to change. Impaired mobility, so you're unable to transfer yourself in and out of bed, in and out of a chair, on and off the toilet, in and out of a chair in the dining room. We really want you to be independent and not rely on other people to help you, other residents to help you. Or if you have severe dementia, so you're unable to care for yourself, you're unable to remember to eat, you have poor safety awareness, and you're unable to use the emergency call system. The resident has to have, criteria for admission to higher levels of care. You have to have needs that the unit can assist with. So if you have a cold, that wouldn't be a need for skilled nursing. We can take care of you in your apartment. Now if you break your hip, that is a reason to use skilled nursing. So it has to be a need that they can assist with. Again, it's not a hospital stay, and you have to have a doctor's order for admission. If you want more information on the Arbor, it's got lots of names. The Arbor, the Healthcare Center, long-term care, skilled nursing. Now we have rehab, healthcare center, assisted living and memory. The third presentation is August 2nd. I think it's August 2nd at 2 p.m. Or we can set up an individual meeting and talk one-on-one about any concerns that you may have. What if I have a pet? So it could be a fluffy pet, it could be a scaly pet. Please register them in my office. We like to know who has pets. We have an emergency list that I update monthly, so it's a list of residents who use walkers, wheelchairs, oxygen, CPAP at night, and who have pets. Because if there's an emergency, we're gonna rescue you and your furry little creature, or scaly little creature. So we need to know if you have a pet. In your refrigerator, has everybody seen their vial of life? So that's that little medicine bottle that has your name and apartment number. Do you take that out of the refrigerator? No, leave it in the refrigerator. It's your emergency contacts. If you have a pet, we would make a vial of life for your pet also. So if something happens to you and you go out to the hospital, we know who your pet contact is. It could be another resident, it could be a family member, but we need to know who's gonna take care of your furry one if you're unable to. We also need to know who the vet is and that they have their vaccinations. If there's an emergency or alarm, seems like this is happening a lot lately. So the licensed areas have to do a fire drill once a month, but then every shift. So once a month, different shifts have these fire alarms. So it may seem like a lot, but the licensed areas have to do them. So we want you to shelter in place with fire alarms, power outages, or weather emergencies. We're gonna give out instructions over the all-call system. If we evacuate, 911 or the firemen that come will help evacuate. We know where all of our evacuation areas are. We go door to door, area to area, just to make sure everybody's safe. Again, I keep a list of residents and their needs, and I update that every month as new people move in, and I send it out to all pertinent staff, just in case something happens overnight. If the power is out, remain seated or have a seat. We want to prevent falls in the dark. I think that nightlight flashlight was given out for Christmas one time, or you get it as a new move-in, something like that. So if you have that, that's great, because then it's powered up and you can use it if the lights go out. If you don't have one, we can get you one, or I can help you purchase something on Amazon. Alexa, some residents have an Alexa, so you can ask Alexa what the weather's like. They can play, or she or it can play music, make to-do lists, set alarms, play audio books, provide weather, traffic, and other real-time related information. It can also control smart devices in your apartment, so you can buy connections where it will turn on and off your lights, things like that. So if you're interested in one of those, let me know. And I was just asked what the demographics in independent living kind of look like. So in independent living, this is not all of Westminster. We have one person that's over 100. Yay. We have 115 people that are in their 90s. We have 112 that are in their 80s, 109 that are in their 70s, and 3 people that are in their 60s. It's a nice little range. We like to keep people around a long time, which is great. And then gender. So in independent living, we have 295 women and 146 men. For what that's worth. I was just asked to put this in a presentation, just a little bit of information. If you have more questions, you can certainly call me.
I just asked if you supply names.
Supply names of, oh. can run a report if you actually want one. If you have more questions, please don't hesitate to reach out. Sometimes the information is better when it's one-on-one, especially if it's really personal information that you may not want to share with other people. But I'm always here. Email, call me. But if you have questions now, yes, ma'am.
This has been brought up several times. I'm sorry, my voice is not
That's okay.
stronger.
I'll repeat it. And then
The residents in independent care have had instances where they have not been able to get hold of anybody over the weekend.
Okay.
And they are, many of them are requesting that you have a nurse or a doctor on duty every weekend.
So we do have nurses on duty 24/7. During the week, 7:30 a.m. to noon, I do the emergency calls. After that, it's a nurse from the healthcare center. If you're calling reception desk, the reception desk closed, so it rolls over to different phone lines. If you are needing a nurse, pull your pull cord or push your pendant, because then it goes to security and they have to come to your apartment. We can also run a report if things are not being answered, because they have to put it in their security report. Things like that do happen, and letting us know is the only way we can fix it. But yeah, there are nurses on duty 24/7. Just push your pendant, because the healthcare center is 24/7. They have to have a nurse.
Well, I know several instances where people have not been able to get help on the weekend at all.
Okay. So
Is that
just,
through the telephone calls or before?
did they call or did they pull their pull cord?
Have to pull the cord.
I know that.
So, I mean, if you want to have those people reach out to
This
me
comes up at every meeting.
at every meeting, okay, I'm sorry.
It's not me.
It's not
I've
you.
never had that problem.
Yeah,
But
yeah.
I do know a lot of people that say, why can't we have weekend guaranteed help?
We do. There is a nurse 24/7. Security responds first, but the best, if you're having a medical emergency, is to pull your pull cord or push your pendant. And I know they're doing an audit right now of all the pendants and all the pull cords, so hopefully all that will be resolved. I hope. If it happens, have them reach out to me, okay?
Okay, I have one other question.
Yes.
I reported something, that was bothering me because it was dangerous.
Uh-huh.
And they said that they couldn't do anything about it because the family would not agree to it.
I know what situation you're talking about. We can talk about that afterward, after this, yeah. Yes, sir.
Well, you mentioned an audit of our attendance
Mhm.
for very dependent on. Is that something that you do directly with us, or is that done remotely?
So it's directly, if you have any concerns about it, what you can do is call reception and just ask for a pendant check, and security will come up to your apartment and push it just to make sure it works. But they're doing an audit where they're going apartment to apartment, checking everybody's pendant.
And that's ongoing now?
It is, yeah. I think they started Preston ground floor, and eventually they'll make their yes.
Question about the pendant, is it only send out a signal when you press the button, or does it have an accelerometer or something that sends out a signal?
There's no accelerometer. It's only if you push it. So if you want an accelerometer, get you an Apple Watch. Okay. It won't notify us, no. So what it could do is notify your family, or you can have it set up where it calls 911. Yeah, so if you're scared you're gonna fall, nervous you're gonna fall, if you have an Apple Watch, some of them have an accelerator in them, so if you fall to the floor, it senses that. Just like there's some life alerts that do that also, our pendants don't do that. Yes, ma'am.
I have a question about the alarm.
Okay.
It seems at a high enough level that it's dangerous to you, enough decibels, that it's dangerous to your ears.
So she's asking about the sound level. So because of the licensed area and because of the population, it has to be a certain decibel. And the I keep saying 911. When the fire chief comes out here, they test that.
Okay.
So they make sure it's at the decibel it's supposed to be at. And they go and make sure everyone is flashing that's supposed to. So yeah, when we have those, the big, not drills, but the big, where you get the memo about the
Right,
alarms
what
going
they're
off,
doing,
they're
yeah.
checking the decibel and that the lights are going off. Yeah. Any other questions? Yes.
Could you please reiterate situations and the timeframe of wellness checks? What it is for, how often?
Sure, yes. So the wellness check program, that's that complimentary temporary program that we have. So it is up to 2 weeks, up to 3 times a day, up to 30 minutes each time. Everybody's situation is different. So say you're on an antibiotic for 7 days and it's hard for you to remember. We may only do wellness checks for 7 days, twice a day, until you're done with your medication. You may have COVID and you're on isolation for 10 days. We may just come see you for that 10 days. Say you have a procedure and it's taking longer to recover and you need it for 6 weeks. We'll come in there for 6 weeks. So they can help with med reminders. They can help you get dressed. They can do some standby shower assistance. If you have an incontinence episode, they can come help you clean up. If a resident falls, then they come and assist the nurse to pick a resident up, provide meal delivery. So if you're not feeling well, they can go pick up a meal and bring it to you. Everybody's situation is different. I know I say 2 weeks, 3 times a day, 30 minutes, but everything is negotiable. It's just not forever. Okay. Any other questions? If not, come see me, email me. I'm here. I'm gonna post this. I may do it when I go back to my office or I may do it tomorrow. So it'll be on the portal if you want to reference this. If you get home, you go through it and you're like, oh, I forgot to ask this question, just reach out to me and I'll answer it.
Thanks a lot.
Thank